Welcome to the Dance to Heal podcast. I'm your host, Jenny C. Cohen. Join me as I share stories of how life is a dance. I'm a cancer survivor, mother of two, and an award-winning performer who found that mind and body-connected movement is vital to healing in a way that is safe and tailored to your life. I created Dance to Heal Wellness featuring the Spotlight Confidence Formula and also authored the best-selling award-winning book, Outside In Recovery, Dancing My Way Back to Myself After Breast Cancer. I will bring new ways to help you on your dance journey and healing path. Are you ready to move? Dance to Heal starts now. Hello, welcome. I have the utmost pleasure of welcoming our special guest today, Whisper. Whisper helps moms decode their hip pain while living the mom life and medical gaslighting. I love the fact that she helps us finish the story that doctors never finish. Welcome, Whisper.
Hi, thank you for having me. I'm so excited.
So we were talking about the when moms have hip pain, and I was asking her, does that usually correlate with perimenopause, right? Will you share with the audience what that age range is?
Uh, Believe it or not, you can start as young as 35, if not sometimes younger, depending on your hormones. Just our bodies love playing with us, always keeping us on our toes.
Well, Whisper, has a breast cancer survivor, oftentimes women after breast cancer treatment, like if we have to go through chemotherapy, we're thrown into menopause from chemo. And
Yeah.
so no one talks about the hip pain that can come from being in menopause from medical treatment. And then before I get ahead of myself, what what does that mean when you're talking to moms with hip pain, Whisper?
It might not even be hip pain. You might be feeling the hip pain in a very well. Okay, let me step back. It very well might be hip pain. Yes. But that pain also can stem from anything. It can stem from the stress in your life, the hormones, the way you walk, the way your knees bend. It could be the way your shoulders are. It could be a wide range of different things. For me, it stemmed from my pregnancy, but it stemmed because I had a tilted pelvic and my pelvic was twisted. And that's how I had the hip problem that could have been prevented from the very beginning. But nobody told me about it until years. And I went through 13 different doctors, and my last doctor sat me down and really zoned in on my body, not what the textbook was saying, but what my body was saying to him just by the way I was speaking to him. And that's how he narrowed it down for me. And he's like, well, this could have been prevented right from the beginning. I'm like, where were you 7 years ago? I could have prevented surgery.
Yes, you've had multiple surgeries, right, Whisper?
I had one with multiple repairs. So I had a pincer impingement, so that's a shaving of your bone, and then I had cartilage damage, which he had to shave down my femoral bone, and then I also had a labrum tear, and I needed 4 anchors into that, and that all could have been prevented this entire time, and nobody helped me,
That's an
or
incredible amount of
nobody
growth.
actually knew how to. I personally did not know how to talk about my body, to explain to the doctor on how to take care of my body. But those exams were coming in and those blood works were coming in clear, which was telling the doctor like there's nothing wrong with me, because they go by the scans. And the way I was speaking to the doctor was not the way that I should have been speaking. I was using the wrong terms, and so was he, or because I've only had male doctors through
Can
this
you
whole
can you
situation.
give us an example of what you said before you were able to find that doctor to help you, and then what you said after? Just a couple different words that were used that made a big difference.
So my main one was I kept a journal. I After a couple doctors, I'm like, I don't. There's something has to help me. I have to help myself. I started keeping a journal. My mistake was the journal I was keeping was only on my bad days. I wasn't keeping a journal on my good days either, like what I did that day. So, with using my 13th doctor, I went in with a big binder full, and I like slapped it on of the exam table. I was like, "Here's all my notes. Here's I every doctor I left, I requested. This one's a big one. I requested that they documented that there's no further testing they could do for me, and they are denying the testing, because a lot of them would not do an MRI because my x-rays were clear. The MRI is more like a 3D type version where they can really see what's going on in your hip. And I knew right away it was my hip. But in reality, it was more than just my hip going on. So I had them document it, and I made sure before I left that office that that was in my notes, that they could not help me any further along. And that is huge, because now when you move to your next doctor, you have all that information with you to be like, hey, here's more info. Because believe it or not, a lot of our exams are not documented. And to make sure you look at it and be like, whoa, 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 you forgot to put my blood pressure. That's not what my blood pressure read, because your blood pressure correlates with your pain, everything, no matter what it is. And I'm small, I'm petite, and I was still told I needed to lose weight. And that's why my hip. So, right? It's insane. So you need, when I say every little detail documented, absolutely. And also have somebody in that exam room with you as well, whether it's a nurse or a friend, a spouse, somebody, and not your babies, because your babies can't talk, but you need somebody else in that exam room to be your backup, because you never know how that doctor is going to treat you. Because I was touched inappropriately my first doctor, and
Uh-huh.
that was not documented.
Oh, Whisper. Well, I voice record every one of my doctor's visits because I
Well,
wanted
I mean,
documentation what they said to me.
yeah, I was 24, 25 when my hip pain first started. I did not know when I was walking in there. And you also, I cannot stress enough, not every hip doctor, not every orthopedic doctor, not every OB/GYN knows the structural of our pelvic and our hip. And you think the OB would, but no,
They don't. They don't,
no.
unfortunately. And I was an occupational therapist and know that, oftentimes it's a means to an end. It's not necessarily why they're in the industry, right? They're on their way to something else. There are people like that. And so, how does I love the reminder to always have an advocate with you when you go to your appointments, to keep
Yes.
double checking what they're putting in the files about you. That's exceptionally important. I
Before you
That's one
even leave
thing.
that office,
Yeah.
make sure you have that, because that can be valuable information to your next doctor, to your third, fourth, fifth, 13th doctor. And that's when I started, I think it was like my fifth or sixth doctors when I really started honing in on it. Because I'm like, I am done with this mind race, this circle, this, it was playing mind games with me. Like, maybe I'm not, maybe I am right. Maybe they are right. It's all in my head. Maybe I am fine. And I knew deep down I wasn't, but it starts playing those mind tricks with you. And that's when I always stress, when you're documenting things, keep a journal, keep it in your phone. We have our notes in our phone. You don't have to go out and buy a fancy journal. Keep it in your phone, the date, the time. And it's straight down to what you eat, how you slept, the goods, the bads, everything. Document it. Because I'm never going to steer you away from having a professional medical person to handle you. I'm never going to steer you away from a doctor. I am going to steer you into the direction on how to speak to your doctor,
Yes.
because every single one of them went to school for the same thing, but each one of them learned a different thing.
Yes, they did. And they're only human. They're only
Exactly.
human. We don't know what kind of day they're having when you walk into the doctor's office.
No.
And we've been really being very proactive when we walk into a doctor's office, because we want to explain to them in detail what we're dealing with versus just giving them the minimum details and hoping they'll guess what's wrong with you. Like,
That's another thing that is huge. Yes, you need all those little details, straight down to, is it a stabbing pain? Well, what does stabbing pain mean? Ask those questions. They should be able to answer that. And if they cannot, have them document that into your chart, that they
yes.
could not explain what a stabbing feeling meant to you and what you should do. Document it. And I cannot stress that enough.
So I have
Document.
a question. 'Cause
Okay.
this is actually something new I'm learning today with you, Whisper. So me as a client or patient of a doctor or any clinician that I'm seeing, I'm allowed to look at the notes that they document of me.
Absolutely. That is your right. Absolutely. You're also,
Audience
you have
members.
the right for them to print it out for you. Before you leave the office, you had the right to have that in hand, in hand. And that's even like if I have dealt with a lot of military as well. And if you're a veteran, get all your documents before you even get out of service, because that is going to be valuable when it comes to the whole disability. You don't really realize that a lot of our stuff is not documented. And I mean, the way that they ask you, well, what's your pain level, 1 through 10? That could even not even be in the chart. No, you want that in the chart. You want every little detail in the chart, because that's going to save you in the long run. And I know it sounds like, well, I'm being a Karen, or I'm negging, or I'm whatever the new lingo is now. You're not. What it is you're advocating for yourself. You're making sure these doctors, you got to think, these doctors see hundreds of patients in a day. They are running room to room to room because they only need 7 minutes to be sitting in that room with you in order for insurance to be collected. In their head, they just got to be there 7 minutes. Okay, next. And they're moving, they're bouncing. Your chart might not be documented until later on. And now he's like, oh my gosh, I forgot what they said, or oh my gosh, I forgot what she said, or things like that. So you want to make sure before you even leave there, it's already documented. Wait a minute. Clear your day. You have all day to sit there to make sure you got the right information. Yeah, absolutely.
That's
all part of medical gaslighting. And what they do, they'll tell you, you're fine. You're okay. It's all in your head. No, it's not. Write that down.
Yes, because we do have more power. And I
yes,
love that.
Tell me why it's all in my head.
Yeah.
Or they'll be like, oh, it's hormones. Well, how can I test for my hormones to make sure that it's so I can rule out my hormones if it is or isn't? Ask for that stress test. Ask for that. And if they deny, please put that in my chart that you have denied my stress test to further investigate why I have pain. And you're not being difficult. You're advocating for yourself. And there's a difference, because you can talk nicely to them. You don't have to be mean to them when you ask these questions at all.
I love this because, I'm 57, and in my day when I was younger, it was always the doctor knew everything. You never questioned. Even staff didn't question the doctors, right? And then as I graduated and became an OT, and I'd be in the hospital saying, oh, really, actually, who's in control is the nurses. They're running the complete show behind the scenes, catching all the pieces that the doctors who are overloaded are dropping, right? And so audience members, I really cannot stress enough for you how important it is that you take note that the only person that can help you get the best care is you. And you don't have to do it in a mean, obnoxious way. You can do it in a kind, firm, boundary setting way about how you expect to be treated, because you're training them how to treat you in the future, by very clearly wanting documentation.
And who knows, you saying that to this doctor either can give them an insight on, oh, wait, maybe I should ask that question, because again, they are only human. But you're also having the voice for another mom, another woman, your daughter, your nieces, to be able to have that voice and get the advocate, to be able to speak freely for themselves to get what they need. And it doesn't have to be about pain. It can be about anything. Mm-hmm. You want to be able to talk and have it taken care of.
Whisper has an amazing array of gifts for you. So when you go to her website, The Hip Whisper, that's with the THE and then HIPWHISPER.com. Okay. She has so many gifts for you available there. And I make sure that you go and take the quiz to see kind of what does it mean when you have hip pain, and she'll help you dissect that. I mean, I remember, I always had pain on and off, and then we were rear-ended by a really drunk motorcyclist. Like he was like trying to whatever. Anyways, I ended up with an SI injury. So where the tailbone aligns to your hip bones, it was completely off. And for a year, I was getting nerve blocks, cortisone shots, procedure where they go and like burn your nerves. Mm-hmm. It didn't help because the actual alignment in my back hip was off completely. And it got to a point where they were like, oh, we're going to do a PRP, where it was like all expensive out of pocket. They had to draw my blood, spin it to get the protein, and inject it into that joint. And then the doctor's like, well, you also have an SI misalignment. And then he sent me to a physical therapist that to this day, 2-3 years later, I still do those exercises, because it turns out, I think, that hip misalignment was already there and it just got worse from the car accident.
Yes. And you got to think the way you still walk, the way you sit, the way you stand, the way your shoes, everything. You have, not you in general, but like in general, we build these bad habits without realizing we have built these bad habits over time. So it's our job to break those bad habits into good. And that's where the hip pain SOS comes into, because we break those bad habits. That way you can check yourself while you're brushing your teeth. Like, oh, hang on, let me straighten myself out. Breathe differently. The way you breathe can misalign things and hurt your hip or your SI joint. It's those silly little things that you don't realize you do every single day because we're so used to it, that can get us all out of whack. And I wish the doctors or the physical therapists would bring that to light. It's like the way you stand, the way you walk, your breathing can even mess it up.
Yeah. Yeah, that's a great reminder because even now, as I'm standing for this particular podcast, because I stand for all my interviews,
Mhm.
I've always been really careful because I notice that most of us, when we're waiting or standing, we tend to prop. We prop on one hip. We're rarely,
Yes.
moving and shifting our positions all the time. And being an occupational therapist for me before my kids were born, I know all about that. Like I have my husband's whole entire workstation set up ergonomically for his best function so he can avoid carpal tunnel, you know?
Yeah.
And we have all kinds of different chairs in the house so that you're always never in one stationary position for too long. And so it's really
Mhm.
interesting that even with that, it's still easy to go into an old habit that when I think about it,
Oh,
and what you're saying was, I'm like, oh
definitely.
yeah.
That's me. I'm constantly adjusting myself because I'm like, oh, got to correct myself. And it's not because we're not perfect. There's no such thing as a perfect human. But what we have to be is more mindful of things. If you're the way you're pushing your shopping cart can be messing everything up, or silly little things like that. It's amazing because you got to think when you get pregnant, your belly, your pelvic is starting to tilt because it's supporting all that weight on on to keep you sitting upright or standing upright. And then all of a sudden, there's no more baby, but we're still used to being in that position that we have not corrected our pelvic back. And I wish at our 6 week checkup, somebody would be like, hey, you got to check your pelvic. That's why I always stress wear your support belt while you're pregnant. And those postpartum bands, it's not a gimmick. Wear those up to a year.
Well, okay,
It's
so I have fraternal twins. I never got any type of thing that you're talking. I have no idea what you're talking about. Explain.
really okay. So with the pelvic, when you the belly bands, it goes right along your pelvic and your hip, and it goes on your lower back and on your bottom and across your front. And then it has a band that goes over your belly and it supports the baby. And that will actually help keep your hips aligned because you tighten up your hip part. You tighten it up as much as you're comfortable with. And that will help keep your hips in alignment. And plus it takes pressure off of a lot of things. It's your BFF without having to be in water all the time. And then when you deliver, they just, now I have seen out of all three of my babies, three different hospitals, nobody gave me a postpartum band, but they sell them at like Walmart and Target. When I had babies, it was Babies R Us, but they have them, and I highly suggest. Amazon has them too, cheap. I highly suggest wearing that to up to a year because your hormones are still all out of whack for months afterwards. Because you got to think now you're adding in breastfeeding if you breastfed. You're adding in all the trauma, whether you had natural delivery or you had a C-section. Either way, you had trauma there. You had an easy birth, you still had trauma. Your body still went through trauma, even though it was easy. So our hormones are insane, and I highly suggest that postpartum belt for up to a year to keep your hips in alignment. And a lot of people they don't suggest that, and I can't stress that enough. And that's what saved me on my last pregnancy. And I did not know that until my third pregnancy, and I delivered her in 2020, the beginning of 2020.
Wow.
And
It
I
makes
had a
perfect
baby.
sense, Whisper. It makes
Yes,
sense. But I never got a post. I was huge with fraternal twins. And they came
yes.
4 weeks early, which back then was considered premature. Not now, but back then 4 weeks early was very premature. And I still remember like how weird it was in my body when they were born. And
Mm-hmm.
one of my kids had really high jaundice, so they made me admit her into the hospital for 3 days. So I'm going back and forth between the hospital and the baby and the other baby at home, and I had no bands on, and like I actually recently had to have my diastasis recti repaired because I didn't know I had a 4 centimeter gap in my front abs for like
Yeah, it's
6 years. I had no
nobody
clue.
talks about that either. And they don't talk about your deep core. Your deep core is literally and I'm not talking about your abs. I know we all want six packs after having a baby. That doesn't happen. Forget the six packs. You want your deep core because that literally holds your pelvic into place and your glutes. I'm not saying that like the nice apple bottom. I'm saying your glutes need to be tighter just so because you got to think that's holding your pelvic up and your guts and everything else. And that can also misalign you. And it's not commonly talked about when it needs to be. And you would think your OB would suggest this, anybody. And so it's not talked about.
No, it's not. It's not. It's crazy. I mean, like I have fraternal twins that are not of childbirth. I mean, I've got my son and my daughter, and because they were elite athletes when they were very young, they're constantly having to readjust their hips because they have to go to the physical because they had gone to Junior Olympics, Whisper. So they had done overtraining at a very young age before puberty,
Mhm.
right? So for them,
Yeah.
it's been this like, oh, I have to get to learn my body I'm going to listen to your body instead of other adults telling me what to do to my body to train at this level.
Yes, don't listen to anybody because everybody's body is different. And I stress that even my littlest, she's 5 years old. But when she gets older, I'm going to tell her, like, hey, you can do this for your body, but listen to your body because your body's different than mommy's body. Your body's different than Susie down the street body. Listen to your body. And if it hurts, stop. Don't do it.
Yeah, yeah.
Don't push yourself.
So we're gonna
Take that
close.
rest because those little whispers are going to turn into screams. And I'm not saying it because it's my name and I'm not, being silly about that, but it's true. Those little whispers that your body's signaling can turn into screams. And that's when you don't want those screams.
You don't want those screams.
Mm-mm.
I mean, that's they suck when your body's screaming, really, because but
Yeah.
then you don't when someone's screaming, they're already in so much stress you can't even understand it anymore. It's just an emergency at that point.
Yes. And
Uh,
as moms, we put ourselves on the back burner. We
yeah.
got to stop doing that. And it's not selfish. Guess what? Screen time is the best time. You need that 5 minutes. You don't need to go to that playground. Pop on your favorite movie, pop some popcorn, and relax. Because guess what? Those babies don't care that they didn't go to the playground. They care that they're spending time with their mommy.
Yes.
Take that rest day. Take it.
Make sure that you are paying attention to your body. If you're having any kind of discomfort in your body, make sure you start documenting it. And then I loved your share in the beginning of the interview, Whisper, when you're saying, "Oh, you also have to note when you're not in pain what happened." Very few women has your acquiring adulthood, right? We're never taught, "Oh, you need your proper rest." Like sleep is very important for us because that affects our cycles, it affects your hormones, even food choices affect everything. And dare I say, if you're not aware that an anniversary that rolls around is really stressful for you, that's something that you want to be really aware of, folks, because sometimes the hip pain is reminding you didn't acknowledge that this anniversary came around, right? And how do you know when
Document the weather. The
yes,
weather can affect with your hips. Every little detail. And I know it sounds so ridiculous, like Whisper. I already have so much going on in my day. I know you do.
Mhm.
But if you could just voice memo it and then write it down later when the kids are in bed or anything, like, oh, I forgot this. That's a stress. You forget your kid forgot the water bottle and you come home. Oh my God, I had to bring that back to school. They have gym at this time. I got to make sure I'm there before that. That's a stress. Even though you don't think it's that big of a stress, it's a stress. So
Yeah.
you make a very valid point there.
Yeah, yeah. We're giving you permission slips to take time out for yourself. Here's a reminder too, because my kids are grown, and if you have kids of any age, understand that you're role modeling for them how to treat themselves by how you treat yourself. So when you say, I don't have time to take care of myself, they're gonna learn, oh, they don't have time to take care of themselves. So it's not just a selfish, oh, take care of yourself first, which is self-care. All right, folks?
Yes.
Really important, it's self-care. That's the big thing that I've been learning these days. There was a famous actress, she was interviewed on a stage, and there's a meme going around where she's like, I was asked once if I'm high maintenance, and I answered, yes, I am, because I maintain it. And I was
I
like,
love
great.
that though.
I am high. Everyone should be high. Well, not should. Everyone has the right to be high maintenance because we're going to
Yeah,
maintain ourselves, right? We get the right to do that.
exactly. And think about it. When your baby comes home sick or they wake up with the sniffles, what do? You comfort them, you put on a movie, you make sure that they get what they need to get to feel better. Because you, as a mom, that is your instinct to make sure that they are better. Make sure that you are showing your kids that mommy can take that time too. And that is huge because that's giving that not only yourself the permission slip, but them the permission slip when they get older. And plus, who knows? You're creating somebody's husband, somebody's wife as well, somebody's mommy, even though we don't want to think that far ahead, but it's true. You're
These,
teaching them
what are they teaching
by
us?
example. Yeah.
By example, right? And don't forget that when you start to break these cycles that you've inherited from the generations before you, that's helping the energy going forward, right? And up the people around you, because then you're at your best versus trying to drain your well dry, trying to take care of everybody but yourself first.
And pay attention the way you speak to yourself. Not only are your kids listening to it, but you're like, oh my gosh, you wake up in the morning and be like, oh, I'm gonna have a bad hip day. No, ma'am, we're not gonna do that. You're gonna be like, okay, how can I move out of bed to make sure that I'm gonna have a great hip day? Instead of bad, you say good or great or something else. You gotta alter the way you talk. And I know that sounds taboo and woohoo or whatever, but it's true. Because the way we speak to yourself as if you're going to speak to how you speak to your babies. Advocate for yourself how you would advocate for your babies.
Well, that makes sense because there's a part of us that was never healed when we were kids. Let's just be honest.
Exactly.
So,
Exactly. You're healing that inner child.
yeah, yep. Whisper, thank you so much for coming today. I think we really hit on a lot of things. I think this is amazing.
Yes, I would thank you for having me. It was great.
We'll have to have you come back because I feel that we only touched a little bit about what you do when you are helping people with hip pain. But I think that
Yes.
all of this is really pertinent, audience member, because of what Whisper had said before, that everything affects your hip. It's like the barometer. And then this is your first time through Whisper's audience, in the whole dance format of belly dancing, there is acknowledgement that a lot of us hold memories and past traumas in our pelvis, and that's housed in your hip. So all of that is correlated, and we'll have to have you come back with us so we can talk more about that.
Yes, you give me goosebumps. I have goosebumps. I know you can't see it, but I have little goosebumps over here.
Yay!
Hello.
All right, so we'll see you all next time. Bye-bye.
Bye. Thank you.
Thanks for listening to the Dance to Heal podcast with Jenny C. Cohen. Come back next time to hear stories of inspiring triumph and learn more ways that you can heal yourself. To work with me and continue your journey, visit danceandheal.com. Are you ready to move?